female reproductive system, the perineum. It's a diamond-shaped area between the thighs. The borders are the coccyx and the pubic symphysis. The anterior urogenital triangle contains the external genitalia, and the posterior anal triangle contains the anal opening. Transverse perineal muscles divide the perineum into these triangles. The perineum. The levator ani. It's the pelvic floor muscle. It inserts at the sacrum and the coccyx. It originates at the pubis, the posterior side, and the ischial spine. The action, it elevates the anus and supports pelvic organs. The levator ani. Clinical perineum. It's the region between the vagina and anus. The skin and muscle here can tear during birth. An episiotomy is where an incision is made into the clinical perineum to prevent tearing. The vulva consists of the labia majora and mons pubis, the labia minora and prepuce, the vestibule, and the clitoris. The function is to protect and enclose the structures of the vulva. Labia majora. It's a pair of thick, fatty ridges that enclose and protect the vulva. Mons pubis. An elevation/mound over the pubic symphysis where the two labia majora come together anteriorly. Labia minora. It's a pair of slender skin folds that border the vaginal opening and urethral opening. The prepuce. It's a fold of skin over the clitoris formed by the labia minora coming together. Prepuce. Vestibule. It's a space inside the labia where the openings to the urethra and vagina are found. It's where the moistness is. The greater vestibular Bartholin glands. There are a pair of mucus-producing glands located on each side of the vagina. The function, lubricating fluid, keeps the vestibule moist. Clitoris, an organ that engorges with blood during sexual arousal and swells. It's the most sensitive points of sexual stimulation because of large concentration of nerve endings. It's the only organ in the human body to exist exclusively for pleasure. The uterus. It's about the size and shape of a pear upside down. Embryos implant, grow, and develop within it. The three sections are the fundus at the top, the body in the middle, and the cervix at the bottom. The cervix is mucus glands here fill the canal with mucus, which blocks substances that could pass from the vagina into the uterus. Cervical canal. It's a canal extending from the uterus to its opening into the vagina. Broad ligament. Main ligament that holds the internal reproductive organs in place. Limits its movement. Extension of the perineum. It's a fold that spreads out on both sides of the uterus. Ovaries and fallopian tubes attached also. 3 layers of the uterine wall. 1, the perimetrium. It's the most superficial and it covers the uterus. The visceral peritoneum. 2, the myometrium, the thick layer of smooth muscle. And 3, the endometrium. It consists of epithelial lining and CT, lamina propria. Endometrium of uterus. Functional layer. It's thicker, innermost, made of lamina propria, CT, and its simple columnar epithelium. The basal layer is thin. It's the deepest part of lamina propria. It's continuous with myometrium. Menses equal period. Endometriosis happens when endometrial tissue organ grows outside the uterus. Vagina. Female organ that receives penis during intercourse. It allows menses and childbirth. It's made of moist stratified squamous epithelium. It's a tube that extends from the uterus to outside the body. Its outer smooth muscle layer allows it to grow in size for the penis during sex and birth. There are no glands, but fluid from epithelial cells leaks out to lubricate. The hymen is a thin mucous membrane that covers the vaginal opening. The fallopian uterine tubes. It's a pair of tubes that extend from each ovary to the uterus. An oocyte or an egg or fertilized egg travels through to reach the uterus. Tissue, smooth muscle and lined with simple ciliated columnar epithelium. Sweeps eggs towards the uterus. Regions of the fallopian tubes. First, the fimbriae, which is the fringe. Long, thin processes surrounding the opening of the infundibulum. They pull eggs into the fallopian tube. The infundibulum comes next. It's a widened part of the fallopian tube where it opens into the peritoneal cavity. And then next is the ampulla, the widest part of the tube, near the infundibulum, where fertilization usually occurs. And then after that is the isthmus, but I don't see that on this part, so I guess we don't have to know it for lecture. An ectopic pregnancy is when the embryo implants outside the uterus, commonly in the uterine tubes. Ovaries. Pair of small almond-shaped organs. Oocyte formation occurs here. Secretes hormones, estrogen and progesterone. The medulla is the looser inner part. Blood vessels, nerves, lymphatic vessels are here. The cortex is the dense outer part of the ovary, and it contains follicles, aka developing eggs. Oocytes and follicles. Primary oocyte is surrounded by a single layer of granulosa cells, special cells that nourish the oocyte to form follicles. Ovulation. It's a mature follicle ruptures, forcing out the oocyte, along with some blood, fluid, and cells. Ovulation. Mammary glands. Pair of milk-producing glands, modified sweat glands, that enlarge during puberty under the influence of estrogen and progesterone. Okay, that's it.